methemoglobinemia. Methemoglobinemia happens when essentially the iron in the heme moiety of hemoglobin loses an electron, basically gets oxidized, and it becomes 3 plus as opposed to 2 plus. The 3 plus is unable to bind oxygen as well, and it actually has increased affinity for the oxygen that's already on the hemoglobin. So the hemoglobin curve shifts to the left, which I'll discuss in a second what I mean by that. Signs and symptoms include cyanosis, headache, fatigue, tachycardia, in worst case, coma, seizures. Essentially, these are all signs of functional anemia, right? You essentially have your cells are hypoxic. They're not getting enough oxygen. So clues to methemoglobinemia is that you develop a cyanosis with a normal PaO2. What does that mean? The oxygen tension may be normal, but you may still have cyanosis present. The blood is often described as a chocolate brown blood, and you actually have your pulse oximeter, which you use on the patient's finger, for example, non-invasive way of trying to estimate a patient's oxygen percentage, would be inaccurate. The treatment would be methylene blue, which is an electron donor, or ascorbic acid. You really would use methylene blue in all patients unless they have G6PD. In these patients, you would use ascorbic acid because methylene blue can cause hemolysis in patients with G6PD and actually worsen up methemoglobinemia. Methylene blue, remember, is also an MAO inhibitor, so it can lead to serotonin syndrome. Nowadays, a lot of patients are on SSRIs, so it is definitely something to consider. Now, going back to what I said about the inaccurate pulse oximeter. So a pulse oximeter, the way it works, excuse me, is that it sends, you put the probe on the patient's finger, and it sends a signal of 2 wavelengths, and it determines how much of each of those wavelengths is absorbed, and those absorptions are going to be dependent on whether the patient has what the ratios are of oxyhemoglobin versus deoxyhemoglobin. Okay, and what happens with the pulse oximeter is that it measures. Let me bring this up here. That's not the one. I apologize. A pulse oximeter, as you can see, measures oxyhemoglobin and then divides it by the total hemoglobin, oxy and deoxy. But it assumes, and you get from here some oxygen percentage status, but it assumes that you don't have any methemoglobin or any carboxyhemoglobin or any other types of dyshemoglobinemias, which is not necessarily true, right?
Like this video and smash that subscribe button as well, and make sure that you hit the bell button and get the notifications for the new videos in the future.